Why is it that you think sort of what's been happening in Western countries is the sort of full lifting of the lockdown and getting back to sort of a new normal, but with social distancing? Why do you think in some countries that just wouldn't work?
I think this is very difficult to work in, as you said, in the resource poor countries, because once you lift the lockdown, there are certain rules that you have to abide to. That in the country you have a generalized testing, you have contact tracing everywhere with a large number of people, either through person to person or through digital means. That's not the case in many developing countries because these are very big, very dense populations. Then you have to have a data-driven feedback policy on, how the disease burden is increasing or decreasing. So incidence and prevalence. You have to look into the health system's bed capacity. Should there be a second wave? Can the health systems cope with it? So all of those things are important to know and important to have to actually ease the lockdown. But in many developing countries, unfortunately, that's not the case.
Do you think there would be social compliance with it, with the government saying, OK, 30 days to get back to normal, 50 days again of lockdown? Do you think it's actually, in practice, going to be something that people would abide by?
I think these are really difficult choices that we have to make. I mean, if you think about 3 months ago, we didn't know that we have to go under lockdown worldwide. So all of these things are very new for us because when you have something unprecedented like COVID, you will have to come up with unusual solutions where you have to make certain arrangements. I completely agree with the fact that the not just individuals but the businesses with respect to the supply chain, etc., needs to also adapt should there be some kind of an intermittent rolling lockdown like this. But we live in an unusual time, so we'll probably have to be flexible and reorganize things accordingly as an option if this is the option, because all the other alternative options like staying in an Europe style mitigation or going into zonal lockdown again is not feasible for many developing countries. So we'll have to think about what could be the other alternative options.